Rhode Island is starting the process of closing two of the three COVID-19 field hospitals that have been in place here since the springtime. As we've reported, they were just set up just in case traditional hospitals ran out of space for patients during a potential surge that we never saw. The field hospital site at the old Citizens Bank location in Cranston will remain open for now, while the other two sites at the Rhode Island Convention Center and the one at the old Lowe's building in Quonset will eventually be dismantled. 12 News reporter Sheena Lusciuto spoke to the director of the Department of Administration and has more on what led to this decision. It's new tonight.
It was early April. The National Guard announced 3 buildings would soon be turned into makeshift hospitals. The old Citizens Bank building in Cranston, the Convention Center in Providence, and the old Lowe's in North Kingstown, all to prepare for a worst-case scenario surge. Director of Administration Brett Smiley explains, we as a state and really our COVID-19 data has come a long way since then.
Back in the spring, we were in a pretty scary place when we stood these up very quickly. We're in a different place today.
So the Department of Health and the local hospitals decided they just don't need all of the field hospitals anymore. The state is starting the process to dismantle the sites in Providence and the site in North Kingstown, which Smiley says was never fully completed, all while they plan to extend the Cranston site's contract just in case.
The idea behind extending it for 6 more months is to get through this flu season, to make sure that we're never in a place where we're out of hospital beds and that Rhode Islanders can sleep a little easier at night knowing that if the worst were to happen, there would be a bed for them. But again, it's not our expectation that we'll use it.
As Smiley explained, not only do crews have to eventually deconstruct the field hospital here at the Convention Center, they also have to put it back together to its original state as well so business can go on as usual. However, as of right now, there will be no changes with the testing site here, so this location will still be an option for Rhode Islanders to get a COVID-19 test. In their most recent update to lawmakers, the Raimondo administration has budgeted $77 million to COVID surge capacity, including the field hospitals.
The total construction and maintenance budget has been about $25 million, and much, if not all of it, we expect to be reimbursed by FEMA. None of it's going to be paid for with local state tax dollars. And all of it will be funded by the federal government through one of those 2 pools.
Meanwhile, as plans move forward, State Senators Sandra Cano and Ana Quesada are calling on the governor to hire minority-based businesses for the job to deconstruct, adding that by law, 10% of all state construction and service contracts must be awarded to minority-owned companies. The lawmakers say due to the circumstances leading up to the building of the hospitals, those contracts were exempt, so not a single dollar ended up going to one, and they're hoping that changes. I'm Sheena Lusciuto, 12 News.